I'm Kelly Kunkel in Fort Worth. I want to take a minute to talk about blepharoplasty, cosmetic upper and lower eyelid surgery. We see so many people in our office that are told that they look tired or sad, maybe like they have allergies. Maybe they can't put on makeup anymore because there's too much eyelid skin in the way. We have some nice procedures to help restore and refresh the appearance of the area around the eyes. How do we do it? How do we do cosmetic upper and lower eyelid surgery? I'm going to talk about ways that I do it typically. I will vary what I do from case to case, but these are general ideas of how I typically will do cosmetic eyelid surgery. Let's start with the lower eyelids. What we're really dealing with in the lower eyelids are three fat tissue pockets, fat tissue bags. We want to do something about those. The way I typically will do that is I will address those through an incision inside the lower eyelid. I'll make that little incision and then I'll go in and trim out most of the fat from the outer bag, from the more lateral fat tissue pocket. I'll take out some of the fat from the inner two fat tissue pockets, and then I'll also drape some of that fat over the rim of bone right there. That helps blend the eyelid and the cheek together to give a nice smooth contour. After I've done that, I also put in a temporary suture internally that dissolves over a few months, kind of hikes the corner of the eyelid up a little bit. That helps minimize the risk of the eyelid pulling down while there's a lot of swelling after surgery. Once I've done that, I'll then make an incision just beneath the eyelashes and take out just a small pucker of skin and then suture that together. People end up with a small scar right where that incision is. Very difficult to see that. Look on our website, look on any website. Usually those are very difficult to see. The upper eyelid's a little bit different. In the upper eyelids, we're dealing typically with two fat tissue pockets, not three. Make an incision as shown here. Trim out a lot of skin. We take out more skin from the outer aspect of the eye than the inner aspect of the eyelid. Once we've taken out that skin, then I'll take out a fair amount of fat from the innermost fat tissue pocket. We don't take out as much fat from the more central fat pocket as we used to. Maybe take out a little bit. Then we close up that incision and you end up with a small scar right in the upper eyelid crease. Again, very difficult to see. That's how we do upper and lower eyelid surgery. Each surgeon may do it a little bit differently, but those are the general ideas. If you've been thinking about upper and or lower eyelid surgery, we would sure love to see you in our office in Fort Worth. In Fort Worth, keeping it beautiful, I'm Kelly Kunkel.